And would you say that there's been a growth in demand from men and women, or more women, or what would you say?
Well, there was a paradigm shift here as well. So in the beginning, it was mainly women that were seeking the cosmetic procedures, but with time, we had like a male cosmetic procedures, like a separate sector. So yeah, still, if we talk in percentage, still women are the majority, but there is a good percentage now of men. Like I would say not less than 20 or 30%.
Yeah.
Of our patients are males coming for cosmetic procedures. Yeah.
And is there one procedure that you see more often, requested more often than
For
another?
males or females?
No, females.
Females, no, it's not one, but there are, like, I would say, few operations which are the most commonly asked for.
Don't tell me, the Brazilian butt lift.
Of course, that's
Oh God!
That's on vogue now.
It is utterly in vogue, isn't it?
Exactly, exactly.
Yes.
But I mean, in general, like I would say, body contouring or liposculpture or high definition liposuction or whatever you call it is demanded now. It entails many procedures, but at the end, it's about contouring the body.
I see.
Yeah, so I think that's the most commonly done procedures. Of course, breast procedures are a lot, either augmentation or reduction or lifting or symmetrization as well. Male procedures, again, body contouring, high definition. People ask now to have a six packs in their bodies and well-defined abs and like full chest, like people go to the gym and so on. So yes, people are aware now of that they can do that.
I've noticed you do beautiful noses as well, don't you?
Yeah, face surgery, actually that's a lovely sector. I love doing the nose and the facelift as well. There is a lot of art in doing the facial aesthetic procedures.
You mentioned earlier when we were chatting earlier that your passion is being able to completely change a person's life through reconstructive surgery.
Yes.
And so I'm really happy to be able to talk to you about this, because when I was here last October, I happened to be sitting in the waiting room. Normally you see, very nicely dressed middle class Egyptians or foreigners as well waiting to see you. On that occasion I saw two, I'm going to be really frank, they looked like street urchins. They looked like young boys, not beautifully dressed, and they came in together and they seemed to be very streetwise, and I didn't want to stare. They didn't look as though they were in place there. I didn't want to stare, but I could see out of the corner of my eye that one of them had no nose at all, and the other one was missing half a hand, something like that. And it was afterwards that your lovely receptionist said to me, when I said, "Whatever happened? Was there an accident?" She said, "No, they are Egyptian." Yes. And they had come to you for reconstructive surgery. Can you tell me a little bit? I can't imagine they could afford to pay. So can you tell me a little bit about how they came to be your patients, please?
Yes. So as you just said, I mean, cosmetic procedures is the majority of our work, and I excel that and I do that with love and excellently and everything. But my passion, my love is the reconstructive surgery, which I went far into. So I do the most sophisticated super microsurgical procedures and reconstructive procedures with love. And as you said, they may be not financially rewarding, and I do many of those in the university hospital where there's no income from that or something like that. But I really enjoy that. I love that because it's a life-changing, it's a life-saving, or sometimes a limb-saving procedures. And you feel when this patient come back to his normal or almost near normal life that you have done something wonderful and magnificent. Of course, we do the same when we do cosmetic procedures, which part of them, for example, breast reduction in huge breast and so on, I would consider them also a reconstructive procedure, but like saving a patient hand or lower limb, or creating a nose or creating a breast after cancer is something that really changes the life and gets that patient back to life and back to social life again. So I feel very, very good about myself doing that, and I enjoy doing that, although it's not rewarding financially, but it's rewarding on the moral level.
Yes, in so many other ways.
Yes, exactly.
Yes.
I love breast reconstruction, so women who have lost their breasts after cancer.
And men who have lost a breast after
and
cancer
men
also,
yeah,
yes.
and men as well, but women more. We do the reconstruction for them because breast in specific is a symbol of femininity for a woman. So again, that would change their mind and social life and marital life when we do the reconstruction of the breast and do the final touches of the nipples and so on, and maybe adjusting the other side. That would change her life completely and gets her back again to their normal life. Recently also, patients again with cancer breast, they develop some sort of edema, what's called lymphedema, in their arms after they remove the axillary lymph nodes. So I started to notice that this is affecting the quality of life of those patients. So even they are happy after we do the reconstruction of the breast, they are still have something which actually reminds them of the cancer, which is the edema, the swelling that comes in their hands. So I became again specialized in this part of work to help them to reduce that swelling and start to use their arms again. So that's a service for women after breast cancer in general.
Yeah, absolutely amazing. Yeah, I'm so glad that we've been able to talk about this.